Thank you for joining us. Welcome to our first webinar for the year. My name is Fiona Charlson. I am up here in sunny and hot Brisbane. I lead the Mental Health and Climate Change Research Network, which is hosted at the University of Queensland. I also like to acknowledge the Queensland Centre for Mental Health Research, through who I am employed. I'd like to start, as always, with an acknowledgement of country on all the lands that we meet today. In the spirit of reconciliation, we would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples who are joining us today. Just a little bit of housekeeping before we get started. We are recording this session and it will be made available through a mail out and our website in the coming days. I would request that you please remain muted throughout the session. There will be an opportunity to ask questions throughout today's session. If you could pop those in the Q&A box, which is different to the chat function. If there is chat that you want to do amongst yourselves or, commentary, please pop that in the chat and reserve the Q&A box for questions that you would like our amazing panellists to address at the end of today, or the second half, I should say, of today's webinar. So climate change is affecting Australia in some really profound ways, most notably with an increasing frequency and severity of extreme weather events. The adverse mental health consequences of climate change are becoming more evident through Australian-based research. Floods in northern New South Wales have been shown to increase the risk of post-traumatic stress disorder, anxiety and depression, with multiple extreme weather events associated with worse mental health outcomes. Significant increases in health service presentations and mortality have been found for people with mental health conditions during heat waves across Australia. Bushfires have been associated with increased depressive symptoms across the East Coast. Drought has been found to increase psychological distress in Victoria, with food insecurity associated with higher distress levels nationally. Another nationwide survey demonstrated that most Australians reported having a direct experience of a climate change related event, and of those, 1 in 4 met the criteria for post-traumatic stress disorder. The state of Queensland, covering the continent's northeast with a coastline stretching nearly 7,000 kilometres, is particularly prone to the impacts of climate change. One of the most recent large-scale events occurred from late 2021 to May 2022, when southern Queensland experienced repeated devastating floods. The state faced one of the biggest recovery operations in its history, with 39 out of Queensland's 77 local government areas being affected. The immediate and long-lasting impacts on mental health were highlighted by the State Recovery Coordinator, who is quoted saying, "These floods, preceded by drought, fires and COVID-19, have tested the most stoic of individuals. There is a hypersensitivity to weather that seems to permeate the entire community. The psychological impacts of this recent disaster will take months and in some cases years to heal. It will last well after houses and livelihoods have been rebuilt." Yet globally, mental health is notably absent from impact assessments and policies related to climate change vulnerability and health risks. This reflects a broader omission of mental health within climate change and health policy and decision-making mechanisms. Few studies have examined how sectors outside of health can mitigate and adapt to reduce climate change impacts on mental health, or reported on issues that could support improved decision-making around mental health and climate change. Out of the 16 national health adaptation strategies reviewed by the Lancet Countdown on Health and Climate Change in 2018, mental health was the least considered climate-sensitive health outcome, mentioned by only 5 of the 16 national health adaptation strategies. So how does Australia fare in addressing mental health and climate change across the policy landscape? Within Australia's multi-level governance structure, who and where is the discussion taking place and being actioned? During today's webinar, we will be presenting preliminary findings of reviews of Australia's federal and state policy documents. We will also take a deep dive into Queensland's local government area policies to see what is taking place in the country's most disaster-prone state. This will be followed by a panel discussion with leading experts in the health and climate policy space, with an opportunity to answer questions from you, our audience. I'm just going to start by introducing our amazing speakers and panellists. First up, we will have Celine, who is one of the lead researchers on our state and federal policy review, followed by Dr. Cleary from Mosaic Insights, who was also involved in that piece. Myself, I will be presenting on our Queensland deep dive. And at the end, we will have our amazing panellists, Fiona Armstrong from the Climate and Health Alliance, Dr. Rebecca Patrick, also from the Climate and Health Alliance, but also the Sustainable Health Network and Health Nature Sustainability Research Group at Deakin University, and Amanda Dryden, who is the Manager of Planning, Development and Environment, Local Government and Planning Association from Local Governments Association of Queensland. I hope I've got that right, Amanda. Also, a very quick thanks to people behind the scenes, Lucretia and Ben. Thank you so much for assisting in the managing our webinar, keeping us on track today. Celine, I will hand over to you.
Thank you, Fiona. I'll just share my screen, get some slides up. All right, so I have been helping to work on the research for the state and federal part of this project, and I'll be talking about our methodology and the framework we developed, which we applied to the Queensland deep dive as well, with only a few modifications. So, for our search of policy documents, we started off by looking at federal and state and territory government websites for different departments and searching for keywords that relate to climate change and mental health. So this included things like well-being and resilience and droughts and floods and environment, all sorts of things. And we gathered about 200 documents from that search, which we then filtered by looking at their focus to make sure they were relevant to this study. We excluded things, about electric vehicles and things like that, which were too specific. We made sure that everything related to federal or state and territory government, and we made sure that we were only looking at policy documents for this research. So we weren't looking at things like Royal Commission reports and things like that, which will inform these policies. We were only looking at the policies themselves. And we made sure that we were looking at the most recent version of these documents, which included drafts. I think the oldest document that was still relevant today was from 2008, but most things are from 2015. So it's all current stuff. The framework that we developed for analysing the quality of these policies, we were using the AAA or AAA framework, which has been in use since about 2008 to look at climate change policies around the world. And as most people will probably know, there's an ongoing issue with climate change policy where some degree of awareness might be present in a certain policy, certain keywords might be present, but specific pieces of evidence to analyse the objective risk and predictions for the future, and specific actions proposed to prevent problems in the future and take proactive steps to improve things are often lacking. So having this framework of 3 different categories of criteria is a way of trying to make sure that there's enough depth and quality to these policies. So here's a short overview of what we developed. We were trying to look at the overlap of both climate change and mental health, which made it slightly complicated because a lot of policies in Australia might be about climate change, might be about natural disaster, might be about health, or might be about mental health. And those 4 categories don't tend to have a lot of overlap or a lot of references between each other. So that was a specific gap that we wanted to address. So we developed indicators to look at the intersection of both of those issues, looking at awareness, analysis, and action with a total of 20 criteria. And I'll just show you a more detailed overview of what we came up with. So for concepts, analysis, and action, we have this. This is our framework that we developed with different criteria, including the concept of mental health, the concept of climate change, and then the links between them. We've got several factors looking at that and looking at natural disasters as opposed to other contexts in which mental health and climate change tend to interact. Yes, and our action indicators, you can see, are split into 3 categories: mitigation, adaptation, and implementation, which we believe is particularly valuable as we're coming into a point where mitigating the effects of climate change is increasingly difficult to do by this stage, and adapting to the inevitable consequences of climate change that are already in place is going to be necessary going forwards. So we have elements of both of those included in this framework, and we have further criteria relating to implementation to make sure that various actions are actually carried out and reviewed. And then for analysis, we took those criteria and scored our policies against each of those criteria to see what level of depth they actually covered. So 0 was no evidence of the criteria. We had a lot of documents with a presence of keywords, which indicates some degree of awareness, but without significant meaningful elaboration. And then on this scale, 3 typically is used for documents such as a document that relates primarily to mental health, for a criteria that is primarily about mental health and things like that. So the entire policy is very much focused on that issue. And 2 is in between, so there's a degree of elaboration without being the primary focus. So once we'd identified our policy documents, we conducted this scoring by several researchers and discussed any discrepancies or subjectivity that might be present. And we found it was quite easy to replicate among different researchers as well, which was interesting because we're proposing this framework as a way of analysing further policy documents into the future, as a way for Australia and the broader region to look at climate change and mental health policy. And the ease with which we introduce new researchers to take part in our group indicates it may be useful in the future for more people to adapt our methods. Yep, so that's the end of my talk. I'll hand this back.
Thanks, Celine. So I'll take over now just to talk us through the results. I'll just start by, again, sharing some slides. So as Celine mentioned, initially we had 200 documents identified from our desktop search of all the various department websites at state and federal level. What you have on your screen here is quite an information-rich table, but I'll just point you to some of the kind of key takeaways. The most important being down here in red text, which shows that we included 93 documents in our analysis that we tested against our AAA framework. In the yellow text on the bottom, you see that there's a pretty even spread of the number of policy documents included across those 4 policy areas of climate change, disasters and emergencies, the health policy area, and the mental health policy area. But interestingly, if you look at the blue text to the side of the screen, you see there's actually quite a bit of diversity in the number of policy documents that met our selection criteria across the various states, territories, and federal level, ranging from 5 policy documents identified from Western Australia, all the way up to 16 policy documents included in New South Wales and South Australia. As Celine mentioned, we had multiple researchers kind of working on this because, as you can imagine, analysing 93 documents across 20 criteria is quite a feat. And actually, I see one of our researchers, Jomer, online today, so a bit of a wave to him. But there's quite an extensive data set that sits behind all this, which I won't bombard you with today. Instead, I'll just talk us through some of the key observations and trends that we've identified in the results across these 4 policy areas. So starting with the climate change policy area, Here we identified 24 relevant documents, and this green matrix on the side of the screen, you'll see has all of our 20 criteria listed. And then the score legend is on the side, where you see that that very pale green shows that the criteria had a 0 score for that particular policy document, all the way up to that dark green, which is a score of 3, where it shows that there's actually quite comprehensive consideration of that criterion within the policy document. So looking at our climate change policy documents, only 30% of them considered the concept of mental health. Just over 30 considered community vulnerability, and encouragingly, over half of the documents looked at community resilience in the context of climate change, with quite a low score relatively across all the other criteria, apart from the concept of climate change. Obviously, I guess, because we're looking at the climate change policies here. The next policy area is the disaster emergency policies, of which we identified 22 documents for inclusion in this analysis. In these documents, around half of the 22 documents recognize the concept of climate change, with just over 40% acknowledging the concept of mental health impacts of disasters. And again, community resilience scored relatively high in comparison to other criteria within these disaster policies. The third policy area we looked at were health policies, where we identified 21 policy documents for inclusion. Only 7 of these documents considered the concept of climate change and how it relates to health. None of the policies we reviewed scored across any of the analysis criterion, suggesting it's quite a high level just mentioning of climate change. And there's only one policy document that scored across wellbeing, healthcare, and stakeholders within that action category of criteria in the framework, suggesting that there's quite a low level of intersection of mental health and climate change in the health policy arena in Australia. The final policy area is mental health, where we identified 26 policy documents, which is our highest number of documents in this category. But only one policy recognised the concept of climate change. And then very low scoring across the criteria in analysis and action, with only mental health predictions, a little bit about wellbeing and resilience considered, but overall quite a low scoring on that intersection between climate change and mental health within the mental health policy landscape. But not to end on a discouraging note, because we looked at the number of policies over time, we see there are some very good markers of progress and improvement, particularly with the more recent policy documents tending to have higher scores across the criteria. So it's moving in the right direction, I guess. And even one policy document we had scored across all 20 criteria. And that's a policy document for Queensland called the Human Health and Wellbeing Climate Change Adaptation Plan, or HCAP for short. And this is a policy document that was developed in collaboration with the Climate and Health Alliance and the National Climate Change Adaptation Research Facility. So there are some kind of standout policies that we can kind of look to for, I guess, ideas and next steps for how we move forward in this policy space around climate change and mental health. Just some kind of takeaways, and as I said, there's a whole extensive Excel spreadsheet and data extraction sitting behind all this, but just some kind of observations to take away that we can potentially unpack in our panel discussion at the end of this seminar. So as I said, as we see with that kind of upward trend, policies are improving over time, and there is greater recognition of that kind of intersection between mental health and climate change in policies, with the more recent policies scoring higher. But there certainly is a gap. And as you can see across those 4 policy areas, the gap tends to be most prevalent in the mental health and health policies not recognising climate change. Interestingly, there is a bit of a spectrum across mental health, so from indicators around community resilience, wellbeing, and mental health, and how these kind of different conceptualizations of mental health are considered tends to vary depending on the policy area. So for example, you see that the climate change and disaster emergency policy areas more readily recognise community vulnerability and resilience, whereas these tend to be a bit more absent, I guess, from the health and mental health policy areas. And as you can see from the 4 policy areas we reviewed, this is very much a cross-cutting issue, where it's not just one specific policy area that owns the issue, but it really needs an integrated policy approach. So that's just some takeaway observations from these data that we can hopefully discuss later in the panel session. So with that, I'll hand back over to you, Fiona.
Thank you so much, Celine and Anne. I'm just looking at the Q&A box here, and I might just push a question in because it's directly related to this presentation. It's from Joe Longman, and Celine or Anne, I'm happy for either of you to answer it. Joe's asked, can we say a bit more about how community resilience was included in the policy documents?
Yeah, sure. Do you want to have a go with that one, Celine, or I'm happy to solve? So I'll start with one, Celine.
How community resilience was included in the policy documents. We found there was a lot of reference to community resilience, particularly in the context of natural disaster and issues like that which affect entire communities. So if you're looking at plans relating to flood recovery, bushfire recovery, there's a lot of talk about mental health for members of the affected communities and delivering mental health services, for example, using different volunteer organisations, coordinating with state and local government response groups. That tends to be the main context where community resilience is discussed, because you're talking about an entire community needing to come together in order to recover from these specific events, which is probably a good example of how we'll need to think about climate change related mental health things going forwards, because it will be an entire community being affected. Does that address the question as to how it was included in the policies?
And did you want to add anything to that?
Yeah, just to highlight again that everything we looked at with indicators was very much around that intersection of mental health and climate change. So if you're just talking about community resilience that wasn't in the context of climate change, it wouldn't have been scored in this framework. But yeah, that's all to add.
Okay, thanks ladies very, very much. I will move on to talking about Queensland. I can work out how to share my screen. Okay, here we go. All right, so we wanted to, in this sort of scope of work, we wanted to look at all levels of government in Australia, but there are 77 local government areas in Queensland alone. So doing that for every state was just simply not within it, our capacity. This work was unfunded, so it was all done, using our core funded positions. So we chose Queensland, being the University of Queensland, and also Queensland is severely impacted by natural disasters and also climate related weather events. So all right, I'm just going to get that out of the way. So what is the policy context in Queensland? So, local governments are really on the front line in terms of dealing with the impacts of climate change. And it's obviously the closest level of government to communities, very in tune and connected with the communities that they serve. But mental health policies and services are typically managed at the federal and state government levels. I won't go into that too much, but I'm sure a lot of you understand why that is, due to the historical structure and development of our health system, and the different remits for different levels of government. And for those who aren't aware, that health is itself, or delivering health services, is not explicitly within the remit of local governments. It's more federal and state. So there's obviously implications there when we're looking at mental health climate change. So this review focused on climate change and disaster-related policies where mental health impacts were are a part of the wide-ranging implications of extreme weather events or climate-related events. When we're talking about disaster-related policies, we're talking about local disaster management plans, which are reviewed annually, and that's a requirement. And also some local governments or councils will take on developing recovery sub-plans and local event-specific recovery plans, depending on the context of their government area. There's also climate change policies which align with the Queensland Climate Adaptation Strategy. So the aim of this study is really to explore how local Queensland councils or local governments' policies are addressing mental health and wellbeing impacts for their communities. The methods we searched is along the same vein as what Celine presented for the national and state level activity. But we searched council websites for each of the 77 LGAs in Queensland. There were 4 categories of documents that we found and included. They were climate change specific policies, local disaster management plans, environment and sustainability policies that included, specifically included climate change, and standalone policies related to specific weather events and disaster recovery associated with those specific events. The policy framework, analysis framework that Celine presented was piloted on these type of documents, and we ended up including the awareness and action dimensions, but we didn't look at the analysis indicators because there was just simply a lack of information in the policies at the local government level. So in all, there were 113 policies assessed, which represented 75 out of the 77 LGAs in Queensland. 9 of these were climate change specific. 75 of them were local disaster management plans, so they very much dominated the landscape. 7 environment and sustainability policies, and 19 specific weather event and recovery policies. And you'll see in the next slides that each policy area addressed the criteria that we used to varying degrees, and there were strengths and weaknesses across the different types of policy categories. So if we look at the climate change specific policies, all documents recognise the link between climate change and health more broadly, but there was very limited recognition of the mental health impacts. Community resilience was addressed in most documents with the emphasis on building community awareness of climate change. And the environment and sustainability policies, there was a high level of detail related to climate change, but no descriptions of climate change impacts on mental health. There was a substantial discussion around the co-benefits of climate action for health and wellbeing, which was promising to see. And also nice to see was that there was higher level of community engagement in the development and implementation of these policies. And the local disaster management plans, most documents recognise climate change and the mental health impacts of disasters, not necessarily the mental health impacts of climate change more broadly, but this was very obviously by nature, they were very focused on disasters. The discussion centred around immediate and short-term recovery. There was a really strong individual level focus on providing counselling services and psychological first aid. So I guess a less of a focus on community-wide impacts, very individual focused. Few documents that describe protective factors highlighted the innate resilience of people and communities, which I really want to emphasise here. But there was no discussion about the impact of increasing frequency of disasters, except sort of factoring this into future reviews, something to look at in the future. And then when we looked at those 15 or so weather event, specific weather event policies, they were not really sort of tied to climate change. Most policies discuss the mental health impacts of disasters, again, without being in that broader context of climate change. Actions had more of a community focus than the LDMPs did. But there was a discussion about the need for broader psychosocial support and promoting community connectedness, in contrast, as well as the importance of locally led responses, which was in contrast, I guess, to the general view of the LDMPs. So in all, there was not, there was a smattering of acknowledgement of mental health impacts, but tightly tied to that related to disasters and not necessarily in a broader context of climate change. And we'll come to that for further discussion in the panel discussion. Just some considerations for policy action. We're still unpacking all of this, but some considerations that have come out of these preliminary findings is that climate change and mental health, it's not only a health issue, and it really needs to be embedded across all policies. It's really a cross-cutting issue. It might be worth reconsidering the division of mental health services between local and state governments, where local governments are on the front line of responding to the mental health impacts of climate change, particularly in the aftermath and recovery of disasters, but over a longer term as well. The mental health responses to climate change should probably be place-based, locally led solutions, which councils are best placed to deliver, but councils will obviously need additional funding, and I'm sure Amanda will have something to say about that to adequately address these challenges. And maybe we need to consider a shift of focus from, it solely being or predominantly being focused on that of individual recovery to community resilience and in looking at the broader system and the broader community. So some examples of policy action could be more collaboration within councils to facilitate knowledge sharing and alignment between policies. A high level of detail about climate change impacts are evident in the climate change and sustainability policies need to maybe be transferred to disaster policies, for example. We might want to take into account the impact of social inequities, which is lacking across all the policy domains. We might want to think about more long-term thinking required to prepare communities for the new climate landscape rather than only reactive responses to individual disasters and this focus on short-term recovery. Principles of community agency and locally led responses demonstrated in the weather event and recovery policies could equally be applied to longer-term planning. This work will require dedicated funding and a bit of resource shifting, probably. And maybe future research should engage relevant stakeholders to understand policy-making processes that are not captured within the policy documents that we've reviewed, and identify barriers and facilitators for effective policy development and implementation in this area. All right, I am going to move on to quickly and swiftly move on to our panel discussion now. I'm going to start, I can see a lot of questions in the Q&A box as well. So I'm going to start with Fiona Armstrong. Fiona, there's a bit of action, important action going on in Canberra at the moment. In terms of a national health and climate strategy being developed. I know you are intimately involved in that process. How is mental health being treated in that strategy development process? And what are CAHA's recommendations for the strategy in terms of mental health?
Yeah, thanks, Fiona, and thanks everyone for the webinar. And can I just say how awesome it is to have wonderful researchers like the people on this call producing policy relevant research, because it really helps advocacy organisations like CAHA to be able to take those insights from research and present them to policymakers to help make the case for action, point to where the gaps are, and identify where investment's required. So I think this is really timely, and I think it's going to be very useful in terms of guiding the mental health aspects of the national strategy on climate and health strategy. So, we are urging consideration of mental health and our national climate change response. There are others in this space as well, like Doctors for the Environment and Psychology for a Safe Climate, and being joined by the College of Psychiatrists. But there's a lot more to do, as we've heard from your research, and it's no different around the world that there's gaps in climate and mental health policy. And WHO has surveyed countries and found that, I think it was 9 out of 95 countries surveyed had included mental health and psychosocial support in relation to climate change in their national climate and health adaptation plans. So there's lots of work to do, and this research is going to be very important in building, the case for action for expenditure, investment and policy. So, at the federal level, there's been no acknowledgement of climate change and mental health under the previous government for over a decade. So it's no surprise that there's a bit of a gap in terms of the emerging policy that is the National Health and Climate Strategy. There's just 5 references to mental health in the current draft consultation paper that will be coming out in a few weeks' time. We're part of the Chief Medical Officer's advisory group, so we've seen an early version of that, and this is one of the areas that we'll be feeding back on. In relation to the rationale for the strategy, it refers to climate change impacts on mental health. Under mitigation, like your research found in Queensland, it refers to benefits for mental health. And also in relation to, in the context of emergency response plans, there's references to the need for mental health care and support, and also recognising vulnerability of people with poor mental health to adverse health impacts of climate change. But there's not yet explicit advice or clear direction on what's required to address this. But this is a good time to be having this conversation, because the draft consultation paper is the first one that will be publicly available in relation to the National Health and Climate Strategy, and it will be coming out in a few weeks' time. There'll be an online portal that will be open for several months, and there'll also be face-to-face engagement. So I really urge you all and everyone who's on this webinar to engage with that process and make sure that it's prioritised. But I think if you can get a chance to brief the team who are sitting behind that with this research, that would be really good. As some of you know, Climate and Health Alliance has been working with our large cohort of member organisations for many years to draft policy guidance for federal and state government, and the HCAP that you referred to is one example of that. But in our healthy, regenerative and just framework for a national strategy, we've called for investment in community mental health programs, also calling for programs that are led by and specific to the needs of Aboriginal and Torres Strait Islander communities, but also highlighting the importance of culturally safe mental health services. We're also highlighting that we really need to invest in vulnerability assessment so that we know exactly, who is vulnerable and where they are to guide policy and investment, and also for investing in building capacity and resilience in communities in response to climate change generally, but in particular in relation to climate change. I was interested to see your call for around community education and awareness, because that's a conversation that's really gaining a bit of traction with the team who are developing the National Health and Climate Strategy. I think they're beginning to understand how important it is to collaborate with others. They recognise that after a long period of disinvestment and ignoring this issue at the federal level, there really isn't that much capacity or expertise in the Federal Health Department, and they're very keen to learn. So they're really, you know, very keen to hear from others and keen to learn from others who they recognise who've been carrying the load during this period, and in the absence of government have built up a lot of expertise, and they're keen to take that on board and to make sure that their work reflects that. So I think, I mean, we've been calling in the governance of the strategy for all mental health ministers to be involved in the oversight of the strategy. There's no evidence of that yet, although there's some encouraging signs that health is working with other portfolios as well. So there's roundtables being organised by the Assistant Minister for Health along with the Assistant Minister for Energy and Climate. So there's signs of collaboration. There's a lot more to do, but I think there's very much gaps, and I just really urge people to get involved in that process.
Excellent. Thank you so much, Fiona. And yeah, you're right. This is just a huge window of opportunity for health and climate change more broadly, but absolutely mental health and climate change, where you know, we're a small community, I would say, in Australia, but there is a lot of knowledge and expertise available. So having that fed into this consultation process is really an exciting opportunity and something that's really super important. Rebecca, I'm going to jump to you. You're from Melbourne. I don't know if you're there today, but you're in Melbourne. You have quite a close relationship with the Vic Health Department, and you're starting to see a little bit of emerging movement in the climate health / mental health space down there as well. Can you tell us a little bit maybe about what's starting to happen down there?
Thanks, Fiona. And congratulations to the team and the research that you're doing in Queensland. I am in Victoria today, but it does feel like Queensland. It's quite hot and steamy down here today. So the Victorian Department of Health, which is I just want to make a distinction here, because we also have Vic Health here in Victoria, which is a health promotion not-for-profit. But I'm going to talk a little bit about what the Victorian Department of Health is doing at this nexus. I'm not from the Victorian Department of Health. I'm a researcher like Fiona, but down here, for context, we have a climate and health team led by Venora Malvina, who's just an incredible climate and health advocate and policymaker, which is situated in our public health division of the Department of Health. And what's really launched that team and the work that's happening in Victoria is the Climate Change Act of 2017, which really supported us to have regard for climate change in public health planning and decision making. And if you take a quick review, and we'll share some links of various resources and guidance documents that have been produced in Victoria, there's a touch point for climate change and mental health in some, if not most, policy documents or guidance documents. If you're only to look up the Better Health Channel, for example, mental health and looking after your mental health in relation to climate change is identified. Now, tuning into the conversation around local governments and municipal public health and wellbeing plans, in Victoria, climate change and health is a must priority for all municipal or local government areas. We have 79 local government areas in Victoria. So all local governments from a public health perspective must have regard for climate change and integrate it into their plan. And so what the Vic state government has produced to support that work at local level is a range of documents, but I'll just highlight one, which is tackling climate change and its impact on health through municipal public health and wellbeing, a guidance for local government. And in there, in various points throughout that document, is improving mental health as it relates to climate change, but also that link to preventing family violence, which we know from the evidence and the lived experience that people have shared over time, that post extreme weather event will see upticks in family violence, which also has a link to mental health outcomes. Pleasingly, in the guidance and conversation in Victoria, is that actions on this nexus between climate change and mental health, we need to tackle it from a holistic manner. So it's a systems thinking approach where we need interventions ranging from, improving access and funding to mental health care. So the sort of illness system, mental health system end, right through to looking at community-based interventions and health promotion and prevention, and developing climate change resilience plans. So there's some fantastic work happening in the Victorian context. There's plenty of guidance, and like the work in Queensland, I've got a PhD student, Nicole, she might be on the line, looking at our 79 plans at the moment under the Municipal Public Health and Wellbeing plans to identify this nexus and to see how we're tracking across the 79 local government areas. I'll stop there, Fiona. I know you've got more panellists to hear from.
Fabulous overview though. Thanks, Rebecca. All right, I'm going to jump down to the local government level now and ask Amanda. So I think it's important to highlight that formal health services are not funded through local governments. Correct. Having said that, Amanda, what do you think that are some of the strengths and unique opportunities that local government have in supporting community health in response to climate change? So what are the strengths and opportunities you think local governments bring? And then a sort of double barrel question, what do you think is probably some of the limitations or barriers to being able to do something in that space?
Thank you very much. Really appreciate being able to be here and talk to everybody from the Local Government Association's point of view. So in terms of the strengths of local government, I think that local leadership, these are the people that are actually on the ground in their communities every day, seeing what is actually happening day to day. So they're very well placed to respond to issues as they emerge. And they're also, our councils are very strong advocates for their communities. So where there's a problem, they are certainly out there saying that there's a problem, and here are the solutions for it. Councils are also really good at collaborating, because none of these problems are going to be solved by one level of government or one council by themselves. So a lot of the climate risks go beyond arbitrary council boundaries. So that ability to work together, but also to work up the government ladder with state and the feds to address issues is something that councils are, very well placed to do. And I think the overriding community commitment to promoting healthy and balanced communities. There's been so much work that's been done, particularly around planning, because I'm a planner, about promoting better and healthy urban places, and also the engagement that councils are prepared to do with their community in terms of communicating their climate risk. And I'd probably bring your attention to probably a fantastic example is our coastal hazard adaptation strategies that were funded by the Department of Environment and Science, and LGAQ has project managed that for them. And this initiative was about coastal councils engaging with their local communities that are subject to coastal hazards, and communicating that risk and working through those issues. And when you're dealing with those communities that might be looking at losing land, or they might be looking at their house being inundated or damaged in a storm tide event, or their property is subject to coastal erosion, those kinds of engagement activities can be quite the difficult conversations to have. The difficult conversations to start having, because you're talking about the place that people live, and working through that in terms of how do you approach adaptation to that risk. And so in total, We have 31 councils that have participated in the program, and we've got 20 completed coastal adaptation strategies across Queensland, with a further 8 that are in their final stages of completion. So that's probably really good news for those communities. The other program that councils have been participating in is our Queensland Climate Resilient Councils program, which was also funded by the Department of Environment and Science through the state. And it's a key deliverable out of the Queensland Climate Adaptation Strategy. This program has delivered services and products to improve Queensland's councils' capability to plan for and take action to respond to climate risks and opportunities through direct engagement and better governance practices, and to provide guidance, resources, tools and support to support action. So we've had 55 councils that have engaged in the program, and we've developed a governance self-assessment tool that looks at how well the publicly available council documents, very similar to what your study's done, addresses climate risk in participating councils. We've been monitoring how councils are performing in those areas since the program began in 2016, and certainly participating councils have increased their ability, or the way that their corporate documents deal with risk. And in terms of the limitations, the big ticket item for local government will always be funding. It's a major issue. Like the CHAS project was funded by the state to the tune of $16 million. But the next steps coming out of having a strategy that tells you what you might need to do to adapt to that climate risk is actual on-ground works. So in those cases where you're talking about coastal erosion particularly, you're looking at major capital works that are going to need to happen in the coming years. So $16 million is going to look nothing in terms of the context of how much money will need to be invested to address that risk. And equally, ensuring that climate risk is incorporated into all council documents will require us, additional funding to assist councils to figure out where they need to adjust those documents, and then also to undertake that work. And then the other big ticket item is, in terms of limitations, is the skills and capacity across local councils to deal with climate risks is different. They're all different. We've got 18 high growth councils, and then we've got other councils that there is no growth at all, as well as our First Nations communities. So I think also just highlighting in this audience that there are very serious rural and remote issues that need to be considered, particularly with mental health. As their location makes it extremely difficult to provide services. So I might leave that there. Hopefully I've answered that question.
Yeah, thanks, Amanda. That's fantastic. I just want to touch on something that came up very strongly in the Queensland deep dive findings, and it was this total dominance of the local disaster management plans. Now, I think it's important to say that local governments are mandated to have these management plans. Correct, Amanda? Mm-hmm. Yes. So that's why there's so many. And most of them seemed to, or it was a significant amount that sort of touched on the mental health impacts to varying degrees. Rebecca, I just want to ask you for your thoughts on what appears to be the general approach to mental health in these local disaster management plans, which is really a focus on a reactive response to a natural or a disaster. We don't want to use that natural word anymore. To these disasters, and the concept of recovery that is implied and inferred throughout these these documents. Is there an issue with that, do we think?
Thanks, Fiona. And this, I suppose, goes under the heading of challenging our thinking, challenging our ways of knowing and doing, and having those conversations to try to move us forward, because there's a lot to be done. So, you know, as you rightly said, there's a long-standing approach to talking about and managing climate-related events such as the fire and floods that we've been experiencing across Australia, which is reactive, with this goal of recovering post to a pre-disaster state. So, you know, bouncing back to something. And, you know, there's been a lot of academic and conversation in the not-for-profit sector around if that's really working for us anymore. And so myself, along with Fiona Charleston, of course, Joe Longman, led this paper and piece where we start to think about, is recovery in the face of climate change a helpful narrative and approach? And at the level of that narrative that there's climate change occurs with single events, that they're unexpected events, and that recovery is time limited, we think that that's not really helpful anymore, and is actually holding us back from some of the work that needs to be done. So let me just unpack those a little bit with acknowledgement of time there, Fiona. So the single events focus, which is kind of embedded in a recovery narrative, is an idea of a single one-off occurrence, and it doesn't really acknowledge that we're actually living and operating within the compound impacts of multiple climate events over time. And again, I want to acknowledge Jo Longman's work in the Lismore area and some of her thinking she's done in this space. That second point is that we're recovering back to something, a pre-condition, as life as we know it, but it's not always possible and unlikely to be desirable where there's inequalities and inequities existing. And then that third point is that somehow in the recovery narrative that there's something unexpected by these events, that it's a shock to us. But, you know, the science is in, we're all very clear that what the scenarios we're living in and moving towards with respect to our emissions and the impact on health. So they're not expected, they are expected, and so to have a notion of recovery along these lines isn't helpful. The way that we are starting to think about it, both in the research, the not-for-profit, and to some extent the policy space, is that we need to think about adaptation, which is something much more inherently dynamic and transformational, and we certainly know that that's what we need under these conditions that we're now living in.
Yeah. Fabulous. Thanks, Rebecca. All right, I'm very conscious of time, so just indulge me. I might go a few minutes over with this. There's some questions here which are sort of interrelated. Some question around how do we quantify the extent of mental health issues that are, so I guess, caused by climate change or attributable to climate change. And there's also a question around the cost involved. So this is the short answer to this is this work has not been done yet. We don't know in terms of numbers what the burden of mental health issues which are attributable to or caused by climate change are. We don't know, and therefore we have not yet been able to estimate the costs. This is work that we are undertaking. We are trying to pull together a team, and we'll be looking for funding for this. This is obviously a really key question that needs to be answered in terms of developing policy. Well, governments have limited resources. They need to work out where do they put their money, where do they invest, and what's impacting communities or populations in Australia the most. So this work needs to be ongoing. Fiona, you've got your hand up. You want to say something about that?
Well, just simply to say, as part of the National Health and Climate Strategy and new Climate and Health Agenda with the federal government, there will be a national climate risk assessment, which we expect to consider health properly for the first time, there will also be a national vulnerability assessment that is undertaken, and presumably a national adaptation plan that will follow that. So there is plans to do that, but there'll be lots of scope for knowledgeable people like yourselves to influence what that looks like and perhaps contribute to it.
Yeah, great. Thanks for pointing that out, Fiona. It's important, and you know, let's all make sure that mental health is included in those, because we know other vulnerability assessments globally have unfortunately had mental health left out of that piece of work. One other question here: does health have a formal specific role in disaster recovery? I'm curious because in New Zealand, Aotearoa Health has the formal lead role for psychosocial recovery. Amanda, do you want to try and have a go at that? Probably the look on her face tells you that no,
No.
it's the formal role.
No,
Okay,
sorry, I would need to take that on notice.
That's okay. So we can speak about, I can speak a little bit about disaster recovery. So, and please don't quote me on this because I'm not in this sector, but from the engagement I've had with that sector, disaster responses, the state does have it's done by the state. It's not done by local government. And this is maybe the disconnect, because health at the state level receives funds to in the post-disaster recovery funding models to deliver mental health services, for example. So you have people from outside of the area going in who to deliver health services, mental health services for a very short amount of time post-disaster. And I'm not sure that we have time to go into all the issues and implications of that. But it's state-led, which would be quite different to what is done in New Zealand, given you don't have the the same governance structures. I'm just going to scan for what I think we'll probably leave it there. I just want to point out that there are a number of questions that we just haven't had time to answer today. We're going to endeavour to try and answer them along with the email that goes out to give you the link to the recording of today's webinar. So thank you so much. I can see there's some really thought-provoking questions there, and we will endeavour to answer them and provide those answers to everybody. We thank you so much for your time, for joining today. I want to thank the panellists, the speakers. I want to thank Ben and Lou, who are behind the scenes. I want to thank the rest of the Mental Health Climate Change Research Network, and particularly those who were involved in the piece of work that we presented today. A reminder that now is the time to be keeping your eyes open for opportunities to feed into the consultation process. The development of policies in climate or mental health and climate space in Australia is increasing, and we would really like to maximise those opportunities. I think that's all I have to say. Thank you so much. I think we could talk about this for many more hours, but I think we've done a good job trying to pull out the major points. Look out for the research. It is not yet published, but it will be published. That will also come through our network correspondence and on our website. Thank you so much.